2022, the outstanding health findings. There were 3 of them. And I think all of them really merit discussion. The first was the COVID-19 vaccines. They held up. The virus, as we know, COVID-19 changes. And every few months, depending on which country you're in, different variants become the dominant ones. And the vaccine to date has had a broad enough immune response together with the boosters, particularly the bivalent booster, to enable us to block serious illness and hospitalization in most people from the virus. And so that's enabled us to have a new normal, to live with the virus. Number 2 is the first effective treatment for obesity. This is a self-administered shot, Wegovy or Ozempic, that works for both diabetes and obesity and targets a receptor called GLP in the body that lowers appetite and changes metabolism. And it really has been dramatic in individuals. And so for the first time, we can get sustained weight loss in individuals, allowing them to lower their risk for diabetes, heart disease, etc. The debate over this really is that it's being used off-label a lot. That is, people paying out of pocket for it, particularly people who have significant resources, to enable them to lose weight. And while that is legal, it's a disparity in care and that people who don't have those resources can't buy it. The third goes back to those same RNA vaccines we talked about in number 1. And they were used in 2 different clinical trials for cancer, and they showed dramatic benefit. That is, right now we use immunotherapy. We give a drug that blocks the don't eat me signal on cancer, allowing your own immune system to attack the cancer. And what the RNA vaccines are used for is to make the proteins in the cancer. So they become personalized RNA vaccines that make the protein in the cancer and enables you to have a better immune response. So those patients with cancer are getting more responses and more sustained immune responses to immunotherapy when in combination with the RNA vaccines. So those 3 really were big advances. You know, a lot of halts on scientific research happened during COVID-19. Now clinical trials are ongoing, and I think there are going to be a lot of advances coming up. But next year, 2023, I think the biggest advance is going to be in big data. That is the use of machine learning and artificial intelligence to better understand what's going to happen, to make decisions in medicine. And you're going to see findings in radiology, pathology, clinical decision-making, choosing the right drug for a patient that will be guided not just on the art of medicine, but now with artificial intelligence to help make those decisions. When we go to a doctor's office, right now, they take a lot of notes and it becomes a bag of words. Well, now it's being converted to structured data to enable computers to learn from each experience and in a privacy-protected way, help your next visit or somebody else with the same disorder do better. You know, Google, the search today is better than the search yesterday. And in medicine, we've always kind of done the same thing. But now every time we see a doctor, hopefully that data can make the next visits better. And so that will herald, hopefully, new ways of doing treatment for all people in this country, no matter who they are or where they're from. So it's going to be an exciting year, I think, going forward.